let's talk about how those services are paid and how they're processed. Now, as your employee, you start to go to the doctor's offices, and as they're utilizing their prescription drug plan, what's going to happen is those claims are coming into the carrier, and the carrier assumes responsibility to pay these out. Now, when we're talking about how the carrier is paying these claims out, there's a few ways that they do this. As far as the medical services component, depending on the plan, the carrier pre-negotiates the rates. Depending if you have a PPO plan or a POS plan, a point of service plan, that's going to depend and vary between the rates you get. Now, here lies the rub, and here lies the issue. Because of the fact that a veil exists here, you really don't know exactly what you're paying for these services. So there's a lack of transparency as it relates to paying out the claims, but you also really don't know the quality of treatment, the quality of care that your team is getting. So I'm going to outline some of the ways that you can protect the costs that are associated with this. But one of the ways that we can protect against this is by cutting out the middlemen. You see, a lot of the reasons that health insurance increases so much is because there are so many payers in between and so many people collecting a profit along as they go. So when we talk about the carrier systems to manage claims from a medical services perspective, they're paying pre-negotiated rates where the rates vary tremendously up to 1,000% for the same procedure at the same location. And in addition to that, there's really no way to control the quality. Again, I'm going to outline exactly how we fix this in a self-insured plan and a self-insured model, how we control for cost variation and for quality. But again, in fully insured plans, these are not elements in which you can control. Because of the fact that there's this veil here, the medical carrier assumes all the risk, so they take all of the rewards from negotiating the rates. But here again, you have carrier consolidation, where I'm sure you've seen recently in the news, carriers like United purchasing Optum, where they've acquired a medical group so that they're in essence paying themselves, but they're also utilizing a pharmaceutical benefit manager, which they own.